So I want to tell you a story about what's in my med bag. This is a pretty important concept to me for a couple reasons. One, I may or may not be a doctor. And two, is I had a fairly serious injury a couple years ago at a shooting course. Nobody got shot. I didn't get shot. Nobody else did. But it necessitated a trip to the hospital and some stitches. So I have kind of changed the way that I carry stuff in my car just to make sure that I have things to fix a bad situation if they arise. So we'll kind of talk a little bit about what I have in my med bag and other supplies that I have in the back of my car just in case for emergencies or minor boo-boos at the range.
What's up, Doc?
So let's talk about the bag here. This is a 511 bag. I'm not sure exactly what type. It's a sling bag though, so easy to get in and out of the car. Obviously got to put some stupid patches on there, the ouch pouch. But we'll start and we'll kind of go through each of the pockets and show you what I have. So I think we'll start on the back here. So every gun guy is going to have a tourniquet. This is a CAT tourniquet. I think it's the most recent generation, but if you're going to the range, you should always have a tourniquet on you. How many times have people gotten shot in the foot, shot in the leg, that kind of thing? In fact, I think earlier this year, there was a guy at a shooting competition, and he actually shot himself in the leg as he was drawing. There's footage of it on the internet. So always have a tourniquet just in case to stop major bleeding from a limb or an extremity. Next, you want to have stuff to clean out wounds. So I've got some sting relief, little alcohol pads, some Band-Aids, and then I also have some betadine swabs. So betadine is a surgical prep. So if you get a really bad gash or something like that, good to clean out wounds and make sure things are sterile. We'll kind of shove things back in so we can continue going pocket to pocket here. So always have something to clean out wounds if you get a laceration. Even if it's not a major one, it's good to clean things out and irrigate things out. In addition to that, and we'll talk a little bit more about my injury when we get to it, but I do carry stuff to inject local. So I've got some needles, I've got some syringes, and then I do carry some lidocaine with epinephrine, just in case someone needs to be numbed up so we can put stitches in or something in the field. In addition to that, always a good idea to have some sort of triple antibiotic ointment for minor cuts and scratches. Also in the wintertime, this stuff is great for preventing dry nose, nosebleeds, stuff like that. So keeping your nose moist to prevent it from having a nosebleed on the range is a good thing. So we'll flip the bag around here. Obviously you want to make it labeled so people know what this thing is. So if somebody gets hurt on the range, you can say, hey, go grab the bag with the big red cross on it. It's very easy to identify, so they can grab it real quick and bring it over. So let's go into the next pouch here. So if you have any med pouches on your kit, there's a lot of different types of bandages and packing material and things like that for gunshot wounds. I would recommend taking some sort of trauma class or some sort of medical class so you know how to use these supplies. I do carry a little bit of ibuprofen, Tylenol, and a little bit of Zofran as well, which is an antiemetic or anti-nausea medication, just in case you have some issues on the range. You never know if you drink that pond water while you're at the range, if you're going to get diarrhea or nausea. I also carry a couple of these liquid IV packs, just in case. I did actually have a guy at a course a couple years ago who was there, and we gave him one of these hydration packs. I mixed it up in a bottle of water for him. He was actively having a heat stroke. So we gave him the liquid hydration, we got him to the ER, and he did well. But always want to make sure that you're hydrated on the range. because you don't even think about it while you're out there, but you're dehydrating every single minute that you're out there. So make sure you have some sort of hydration and electrolytes. I've got some non-stick pads. These are also called Telfas. They're essentially a non-adherent pad that you can stick to a wound if you put a little bit of bacitracin or triple antibiotic ointment on there, so it doesn't get stuck in the wound if you get, say, a minor scrape or something like that, and just tape it on there. Another thing that's really helpful is Vaseline gauze. So Vaseline gauze is just gauze that's coated in either Vaseline or sometimes it's coated in an iodine Vaseline. I don't think I have any in here of that type. That's called iodoform. But this will occlude sucking wounds. So if you have, say, a sucking chest wound or something like that, you can pack that in there as well as using a chest seal to try to seal it off so you don't develop something called a pneumothorax, which is a punctured lung. Other things, this actually came in very handy for me when I had my injury, and we'll cut in some footage of it at some point, but this is Coban, which is an elastic dressing that you can wrap around, and it puts compression on wounds. So if you have a venous bleed, meaning bleeding from a vein, it will allow for more pressure on the area because it compresses down very easily. A lot of the times you can occlude vein bleeding or venous bleeding just by putting pressure on it. If it's arterial, then you may need a tourniquet. But just putting some pressure on it with some pads and gauze and things like that and wrapping it up, a lot of the times for a venous wound can really help stop it.
Oh, fuck. Nice slide, brother. Hey, hey, that was kick ass right there. And it's on video. Oh, hey, time out. Listen to that. Hey, hey, is there a doctor in the house? Need a tourniquet. Holy
In addition to that, I've got some Kerlex, which is just some kind of long strip gauze. This stuff is good for packing into wounds. I can't remember how long. This is 4 yards of gauze, and it's about 4 inches wide. So if you have a deep wound, you can kind of pack it into the wound to put pressure on things to stop bleeding. In addition to that, I've got some Israeli bandages. These are good. I'm not obviously going to open this one, but good for putting compression on an area. And they've got these little straps that you can wrap around a limb or an extremity. Got a couple of those. These are called ABD pads. So the trick with these, you see the blue line on there? The blue line points to the sky. So the absorbent side of the pad, ABD actually stands for Army Battle Dressing. The absorbent side of the pad is on the white underside. The blue should go out. So you put it directly on a seeping wound and it'll start absorbing. It's kind of like a maxi pad or something like that.
Why is it your period?
It absorbs a lot of blood, so you can put pressure on an area and compress it. Got a couple of those just in case. And then obviously we talked about chest seals a little bit earlier. So these are hyphen vent chest seals. They usually come in packs of 2. The reason why is if you have a penetrating chest wound, you can potentially have a sucking wound that will cause a pneumothorax or a deflated lung. So putting a seal on that can prevent air from continually leaking into the chest wall. If that happens, you can potentially compress some of the major vessels around your heart. You can potentially fill up with blood. It's a very, very bad thing if you have a pneumothorax. So this can be helpful to stop that from happening. A tension pneumothorax can be fatal. So if you get a lot of pressure in there, it can actually kill you. In addition to that, I've got some quick clot. This is some clotting type gauze that has some clotting agent on it. I can't remember the specific type of clotting agent, but this is one of those things that you can pack into a wound and it helps start coagulating the blood so it does not continue to bleed. In addition to that, nasal tampon. So we talked about nosebleeds earlier. I have actually seen someone with a nosebleed on the range before. So if you know what you're doing with these, go for it. But these are another thing that can be pushed into a wound to help absorb blood and kind of clot things off. So I got a couple of those. And then an emergency thermal blanket. So in any emergency kit, you should have some sort of thermal blanket. What happens if your car breaks down in the middle of winter? I mean, out today it's like 4 degrees. It felt like -7 earlier. So why not have some sort of heat source and or a thermal blanket just to retain heat if you break down or something like that. So we'll go to our next pouch here. So other things that I have in here, irrigation. This is actually really, really helpful. So some sort of saline irrigation. This one's still good. You want to make sure you check expiration dates on everything, and when things expire, switch them out in your kit. But if you have, say, a scrape-like wound, you can get gravel, you can get dirt, you can get dust into the wound. Sometimes if you're on the range, metal fragments, things like that. So flushing the wound out can be very, very helpful to make sure that you don't have contaminants and potentially things that get sealed back inside when you end up having stitches later. Here's some more irrigation as well. And then it's always good to have water on you. In fact, I've got more water in the car just to make sure that if somebody is thirsty, if someone needs electrolytes, something like that, you can have that readily on hand. We talked about numbing up wounds earlier. This is a stapler. So if you have a pretty easily accessible linear laceration, sometimes just if you wash it out, you clean it out really, really well, you can staple it up. Obviously, if you have a penetrating trauma, you should probably also be on antibiotics, but this is something that if you know how to use it and if you have one, sometimes that can help kind of seal things up. In addition to that, this is called an endotracheal tube. Now, endotracheal tubes, if you don't know how to use this thing, then I wouldn't necessarily have it in your kit. But in certain situations, if someone is losing their airway, meaning they're swelling in the neck or swelling in the mouth and preventing them from breathing, sometimes you will need to insert one of these through the neck to give them an airway. I'm sure you've seen all the movies where they take a pen and stab it through somebody's neck to give them an airway. If you understand how to do a surgical airway, then this may be a lifesaver for somebody. So having some sort of surgical airway. Pocket constitution, enough said. This is a battery cautery, and I think this one may be close to expiring or has already expired, but this is one of those things that if you have bleeding that you can't get stopped with packing material or edges of the skin that are bleeding, this actually heats up at the tip with a little battery-powered wire, and that can cauterize or seal blood vessels. I'm not going to take it out because obviously it's sealed right now, but you can cauterize blood vessels to prevent more bleeding. In addition to that, we talked about airway stuff. This is called a nasopharyngeal airway, or an NPA. So these, you lubricate this. It's like a little trumpet that goes into the nose and angles down into the airway. So if someone has a penetrating trauma to the face or neck and they're having swelling, sometimes this can help stabilize their airway. You lubricate the tip of it and just push it through the nose. You have to remember that the floor of the nose kind of angles down and away. So you want to push down and away with it, and it should be pointed towards their lungs down. Trauma shears. Always have a good pair of trauma shears in your bag. The reason why is you have to know where someone is bleeding from if they have a penetrating injury. So sometimes their favorite pair of range pants, too bad. It doesn't matter. You got to find the bleeding source. So whether it's cutting off a shirt, cutting off some pants, getting access to the area so you can more readily assess it, always have a pair of trauma shears in there. Like we talked about earlier, a surgical airway is sometimes needed. This is a scalpel, essentially. So if we need to get into their airway, we can. Then we've got a couple other surgical instruments. These are for fishing things out. This is a little Kelly clamp if they've got a little piece of shrapnel in their leg or rocks or things like that, cleaning out wounds, or potentially clamping off blood vessels that are bleeding that you can't get to stop. This is a needle driver, so if we're going to suture somebody up, we can use this to suture. Scissors to cut any suture, pickups to pick up either the needle and or the flesh around the wound. some more scissors, and obviously another nasal tampon because we love those, another scalpel. And then here we've got suture material. So these are different types of suture material for just in case if someone has a laceration on the face, on their hand, something like that, something easy to fix, and I'm around and we think it's clean enough after we've washed it out, I'd be happy to suture them up. I have had to suture up friends' kids and things like that in the past when they got a little laceration. One of my buddies called me one time. He was working on his washing machine and had cut a laceration in his leg, and we got him over and we closed things up for him. So if you know how to use it, use it. If you don't know how to use it, obviously you don't need it in your bag.
You need to cut the pants off?
Yeah, cut it off. All right, you don't have bone showing, but I think you got flat. We got
to get stitches for sure.
yeah. All right.
Does anybody have medical kit that can do stitches? Because I can sew myself up.
We can get a tourniquet on you.
Mike's got med kit coming over.
I said we can.
Anybody have any hand sanitizer?
No.
I do. It's got shit in it, man.
Many months later.
And then obviously some sort of hand warmer. Staying warm is really important, especially if you're out at a course in the middle of winter or something like that. It's helpful to have some sort of warmth. Frostbite's bad, so you don't want that. And then in addition to that, in the car, other than the med kit that I have, I've got a couple other things. So I've got a range mat, just in case we're going to do some prone shooting. Who doesn't like being comfortable? So why not have some sort of chair out in your car? So a little fold-up lawn chair, something like that. Source of energy, source of hydration. It's always nice to have a little bit of caffeine in your car, give you a little pick-me-up at the range. Another thing that people don't really think about at courses is sun protection. So some sort of sunscreen, and then also depending on where you are, if you're in Georgia in the middle of the summer, maybe you should get some bug spray. And then finally, the last thing that I always have in my range bag and or the car is some sort of D-lead soap or a D-lead wipe. If you have kids, you don't want to bring that stuff home. If you get lead on your kids, that can be really, really bad for their development. So make sure that you're cleaning off your hands, make sure that you're taking a shower, changing out of your range clothes when you get home, because you don't want to get your kids all cross-contaminated with that. So things to think about. Like I said, my injury was fairly bad. I had a big laceration on my knee, and it required going to the hospital. It required getting stitches, and it kind of shut down the course for me for the rest of that weekend, which sucked. So first of all, don't trip and fall, especially on a gravel range. But two is make sure you're prepared to take care of injuries. Even if it's not suturing up a wound, just having packing material, just having a Coban, something to put pressure on a wound until you can get to a place where you can receive medical care. It's really, really important. Every time you go out to the range, you are potentially in danger. Even if you're the most safe guy on the range, you want to make sure that you have stuff to help yourself or potentially others who are there. So really important. This was a little bit heavier of an episode today and unscripted, obviously, but really important for me to impart some knowledge on you guys. So go out, get some medical training, make sure that you're up on all this stuff, and whatever you can do to help somebody else, do it. I'm glad you stopped by. This is the Pop Doctor signing off. I may or may not be a doctor. Like, comment, subscribe.